Let's go now to London and speak to TRT World's health correspondent, Nicola Hill. Good to see you, Nicola. Tell us more about this patient.
Well, as you said there, Maria, what we've been told so far is that he was a relatively healthy young man with no obvious underlying health conditions, who first of all had the symptoms back in March of sore throat, a cough, and nausea and diarrhoea, which initially weren't actually linked to coronavirus. But a few weeks later, he was given this positive test. He got better. He had a couple of negative tests, thought he was completely clear. But then at the end of April, his symptoms came back with this breathlessness. So he had to go to hospital, he had to be given oxygen. So he definitely had a much more severe case of COVID-19 then. The test came through, and again it was positive. Apparently a parent that he lived with was infected at the same time. So this study that's in the Lancet Infectious Diseases journal speculated whether at first they thought that what had happened was that his infection had dampened down and then flared up again. But what they've done with investigations is to see that there was a difference in the genetic codes of the virus tests, the one done in April and then the one done later with the second infection. And that's why they believe that this is a reinfection and one that's more serious. Now, as you said, there's been 5 so far. 3 of them, it was much milder. The first one was a guy who was in Hong Kong. He had absolutely no symptoms when he landed there, but was having a test as part of their policy, and that came back positive again. But there has been one other case in Ecuador where somebody had a second infection that was much more serious. So there's been a lot of speculation, a lot of discussion from medics about this. Dr. Simon Clark from Reading University said it's the question that everybody wants to know. What is the possibility of reinfection? There have been over 37 million cases so far, and we've only heard about 5 reinfections at the moment, but then we've only been learning about the virus from this year. But one thing that Dr. Clark says is that this possibly would put pay to any idea of herd immunity. You know, it doesn't mean that if you're immune the first time, you're not going to get it again. You may well get it again. And Professor Paul Hunter, who's from the University of East Anglia and a professor of medicine, says it's definitely something that needs investigating, because it just shows that we don't really know how the body's immune system is necessarily responding to COVID-19.
So many unknowns there, Nicola. And what does this mean for vaccines then?
Well, this is something that the authors of the report in the Lancet themselves have said it definitely could have implications. We're all hoping that there's going to be one vaccine that's going to definitely make us all immune to getting COVID-19. Now, if there's a possibility of reinfection, that's not necessarily going to be the case. If you think of flu, for example, we know there's different strains of flu, which is why the vaccine has to be changed every year when they know which is the strain that's circulating the most, and they have to alter the vaccine and you have a new one every year. Will that happen with COVID-19? We don't know. You have other diseases such as dengue, for example, which has 4 specific strains. And if you have one of the strains and then you get infected again, you have a more severe illness. And that's caused a lot of problems with the development of a vaccine against dengue, because effectively by being vaccinated, it's giving you that first strain, so that if you come in contact with the virus, you're going to be more seriously ill. So there's a lot of issues we still don't know about that. You have got vaccinologists saying, or pointing out that, you know, there have only been these 5 cases so far that we know about reinfection. So hopefully they're a rare phenomenon. There's something else going on in those people's immune systems, and that if we do get a vaccine, it will be effective. But Maria, we simply don't know at the moment.
Nicola Hill in London, thank you very much indeed. We appreciate it.